Welcome to a new episode of Medicine in 3 minutes. We go straight to the point. The subject is bravely made clear and often illustrated. Let's start. Today's topic is about craniopharyngioma. During this presentation, we will see successively an anatomical reminder of the Celtusica and the optic chiasma, what distinguishes the craniopharyngioma from the Rathke tumor and from the intracellular arachnoid cyst. In addition of symptom, diagnostic, and finally treatment. Celtusica, there is anterior crinoid, there is posterior crinoid, here's the sphenoid sinus, and this is the double floor of the Celtusica. A craniopharyngioma is a rare type of brain tumor derived from pituitary gland, embryonic tissue that occur most commonly in children, but also affect adults. It has a prevalence around 2 per 1 million. Peak incidence rates are childhood onset at 5 to 14 years and adult onset at 50 to 74 years. People may present with bitemporal inferior quadri-ontanopia leading to bitemporal hemianopsia, as the tumor may compress the optic chiasma. Relationship between craniopharyngioma and optic chiasma, the crossing of posterior fiber here. Craniopharyngioma are distinct from Rathke tumor and intracellular arachnoid cysts. Intracellular arachnoid cysts or leptomeningeal or arachnoid cysts are lined by a single layer of mesothelial cells surrounded by collagenous layer. Cysts are benign, fluid-filled mass that can cause loss of pituitary gland function. Rathke cysts, on the other hand, are classified as developmental abnormality. They are not tumor. Like craniopharyngioma, Rathke cysts form during early development of the fetus from a structure known as Rathke Pouche. They do not usually cause any symptom. We can summarize symptoms of the craniopharyngioma like this: slow growing brain tumor, more common in children and elderly. If large tumor, vision problem. It's known as Rathke Pouche tumor or Adamantinoma. There is a stunted growth in addition of increased urination, thirst, and after treatment, who's to blame for recurrence after surgical removal? Here is optical chiasma, and remember about bitemporal hemianopsia. Remember, intracellular arachnoid cysts, leptomeningeal or arachnoid cysts, are lined by a single layer of mesothelial cells surrounded by collagenous layer. Cysts are benign fluid-filled mass that can cause loss of pituitary gland function. Rathke cysts are classified as developed abnormality. They are not tumor. Like craniopharyngioma, Rathke cysts form during early development of the fetus from a structure known as Rathke Pouche. They do not usually cause any symptom. Craniopharyngioma, known as Rathke Pouche tumor or Adamantinoma, more common in children and elderly. Slow-growing brain tumor, stunted growth, if large tumor vision problem, increased urination, thirst after removal, after surgery, how to blame for recurrence after surgical removal. Because the optic chiasma, remember of bitemporal anopsia. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the like button and subscribe? Your comments are very welcome. Thank you.